to listen to your body and advocate for your own health when it feels like no one's listening. Our Nohalani Graf is sharing her story.
Jessica Dede was 20 weeks pregnant when the symptoms began. Shortness of breath, a racing heart, feeling exhausted doing the smallest tasks.
My heart would just race really fast. I felt like I was running a marathon just walking to the grocery store and stuff. It felt different than my first pregnancy.
Dede's OBGYN diagnosed her with anxiety, but Dede knew something more was wrong. So she asked her doctor for a referral to a cardiologist. And it was advocating for her own health that likely saved Dede and her unborn child.
I knew that it was an anxiety, and it had to been something else. Honestly, I didn't think that my heart was failing. Like, that was the last thing in my head.
That appointment with a cardiologist revealed Dede had cardiomyopathy, a disease that makes it hard for your heart to pump blood to the rest of your body. If left untreated, it can lead to heart failure. And that's exactly what was happening to Jessica Dede.
It was so casual the way he said it. He said it like, oh, so don't worry, but your heart is failing.
Dede's diagnosis was hard for her and doctors to grapple with. Dede was healthy and young, not someone you'd expect to have heart disease. But Dr. Patel says that's a common misconception.
I think a lot of people assume that because you're younger and you're healthy, that you can't have heart issues. And that's just not the case anymore. We're seeing people with cardiac issues younger and younger.
Heart disease is the leading cause of death for women in the U.S., according to data from the CDC. And for women like Dede, it can be hard to have doctors take their symptoms seriously and to catch a potentially fatal disease.
Everyone made me feel like there was nothing. It was like in my head or something.
I mean, I think, like, unfortunately, a lot of patients, tell me that, they've been to other doctors and, their complaints have been dismissed. And sometimes, all it takes is listening to the patient and listening to their story and, coming up with the appropriate testing that needs to be done.
Dr. Patel says physicians need to become more educated when it comes to women and their heart health, particularly because many leading heart studies focus on men. But he also says it's important for patients to keep pushing for answers when they feel their health is not being taken seriously.
I think we need to educate other physicians and stuff too, and patients as well, that they're not, if they don't feel right and if they feel like something is wrong, then they need to pursue answers until they find somebody that can give them the right answers.
And that's something Dede wants all women to remember.
Just trust, your body and get answers, push for answers, and don't take no for an answer.
I'm Nohalani Graf, ABC 15, Arizona.
A great reminder, you have to be a self-advocate. One common side effect of the pandemic, no matter if you had coronavirus or not, weight gain. Next on the bulletin board, how to set yourself up for success.